Hi, Willow, welcome.
Hi, Krishna. Welcome. Sorry, I was a little bit late, but I hope we seem to be all here. So let me know when we can start.
Hi, everyone. Thank you so much for joining us today. My name is Nasheen Hawk, and I work on the Diagnostics Pillar Coordination team at FIND. So before we kick things off officially, and while additional colleagues are joining the call, I just wanted to take the time to talk through some housekeeping issues to keep in mind. So I'm pleased to share that today we have co-interpretation in both Spanish and Portuguese. So please select the channel for your preferred language by clicking the interpretation button on the bottom right-hand corner of your screen. The bulk of our webinar today will be focused on Q&A. So while we're talking through the initial quick overview of the RFP, please feel free to utilize the Q&A box to register your questions for the panelists. Please do not use the chat function for your questions and keep all of your queries to the Q&A box. To ask a question live to the panelists, please utilize the raise hand function, and we will invite you to speak and unmute you so you're able to ask your question directly. And lastly, I do want to note that recordings of today's webinar, as well as yesterday's session, the discussion material that's presented here today, as well as a frequently asked questions document, will be available on the FIND Calls for Partners page, the same page that also hosts the RFP. So with that, I think we can probably get started. Willow, would you like to kick off, or do you want to allow a few more minutes for additional audience members to roll in?
No, it looks like the timing is right. We're a few minutes past the hour and we have almost 70 participants, so I think we can start. And I would like to do that by welcoming everyone. To this second overview of the RFP that we have launched together with Unitate as FIND, the Global Alliance for Diagnostics, Unitate, and our partners in the ACTA Accelerator, UNICEF and CHAI, who will be working together with us and are working together with us through the Advocacy, Communication, and Community Engagement Task Force. The ACTA Accelerator is a groundbreaking global collaboration to accelerate the development, production, and equitable access to COVID-19 tests, treatments, and vaccines. We as FIND, the Global Alliance for Diagnostics, are co-leading together with the Global Fund, the diagnostics pillar of this work. And Unitate is a co-lead of the therapeutics pillars. And together between FIND and Unitate, we jointly focus on the test and treat strategies that countries need to implement and get to scale to get us out of this acute phase of the pandemic. We launched the RFP called the Development and Deployment of Advocacy Strategies to Promote COVID-19 Diagnostic Testing and Linkages to Care, mouthful, in low and middle income countries. This is the area of work. What we see as an opportunity is to work together with NGOs, CSOs, other in-country partners in low and middle income countries to create an enabling environment for increased access to and the scaled use of COVID-19 testing and linkages to treatment. We know that vaccination continues to be a cornerstone of the global COVID-19 response, but that health interventions like testing and treatment are critical to prevent transmission and to save lives. We have seen this very urgently now with the emergence of the Omicron variant and other variants of concern. The advent of low-cost rapid tests, so-called rapid antigen tests, is facilitating more decentralized and community-based testing approaches. And this is where community-based organizations, NGOs, awareness-raising groups, PR, media come in. So greater provision of tests, simply procuring more and making sure they're cheaper will not increase uptake on its own. So we want to draw upon the experience of communities and civil society for a successful rollout of enlarged testing. So I would finalize by basically saying that world leaders have basically come together and have indicated their goal to get testing levels at an equitable level globally. And in order to get that done, we need context-sensitive advocacy strategies. So ones that make sense for each of the countries on their own. We want to get the testing rate to 1 per 1,000 people per day. And one of the basic, really big needs that we see is information, awareness raising, and this is where this RFP comes in. So I will have my colleagues Nosheen and Karishma to take us through some of the key scope and deliverables, and then we'll be opening for questions where I will be available. Thank you very much.
Thanks so much, Willow. So I'll take a couple moments to just quickly run through an overview of the RFP. As Willow just mentioned, this is a joint effort between FIND and Unitaid in their capacities as co-conveners of the Diagnostics and Therapeutics pillar, with a goal to create an enabling environment for increased access to and scaled-up use of testing and linkage to treatment in the target regions. The target regions here are defined as LMICs as categorized by the OECD. The total envelope is around $2 million US dollars, with an average anticipated award of 50 to 100,000. And as many of you will know, the RFP has been issued and applications will be accepted in English, French, Spanish, and Portuguese until the closing date of February 2nd, 2022. To quickly go over the scope and expected deliverables of this call for proposals, the applications are restricted to national or regional health awareness raising and advocacy activities. In this case, we're using regional to mean a region within a country, not a sub-region of multiple countries. So applications focused in, for example, South India would be more than welcome, but we would not accept an application proposing activities across all of South Asia. To reiterate what Willow just went through, we encourage applicants to consider advocacy approaches that will increase testing rates in line with stated UNGA testing targets, 1 test per 1,000 per day, and demonstrate adequate linkage to treatment. And the activities proposed should be centered on developing strategies, literacy, messaging, and media content that's tailored to local context, as well as consider wider dissemination and amplification of these messages. We expect partners to develop a multi-pronged advocacy strategy for increased testing and demonstrating linkage with treatment, tailored to, again, the local context. So these messages should be tailored and pressure tested through focus groups, social media, etc., to demonstrate relevance to the local region or identified target audiences. We expect partners to produce advocacy and educational materials translated to the appropriate local language, and again, tailored to the local context for both high-level advocacy and community-level outreach. And lastly, we expect the dissemination and amplification of these strategies and materials via multiple channels as appropriate, again, for the local setting and the stated target audience. So we've had a few questions already on the applicant profile. So we're very intentionally trying to have as broad an approach as possible. So proposals are welcome from a very wide range of country-level organizations in LMICs. So for example, health sector implementers, marketing agencies or PR agencies, advocacy organizations, not-for-profits, NGOs, and community-led and civil society organizations, as well as faith-based organizations. However, this is not a definitive list, and we welcome proposals from any organization as long as you can meet the basic criteria as detailed in Section 8 of the RFP. So to aid applications in assessing themselves against the exclusion criteria, we've created a short self-check form, which is Appendix B within the RFP. But I do want to note to everyone that the self-check form doesn't cover all of the eligibility requirements. So please review the exclusion criteria within Section 8 of the RFP prior to submitting your proposal. Now I'll hand over to my colleague, Karishma, to walk us through process and timelines.
Thanks, Nosheen. And we just wanted to use this opportunity to reiterate to everybody the timelines and the deadline. So basically, the proposal needs to be submitted by the 2nd of Feb 2022 via the email ID advocacy_RFP@finedx.org. Applications and supporting materials can be submitted in English, French, Spanish, and Portuguese. We published this RFP on our website on the 12th of January. Yesterday, we had our first webinar for applicants, which was available to everybody, along with interpretation in French. And the recording from that webinar is already up on our website on our Calls for Partners page, and I'll drop a link to that page in the chat shortly. Today is our second applicant webinar with interpretation available in Spanish and Portuguese. We are inviting written queries. We've already received a load of queries and we're trying to respond to them in real time. In case we haven't yet responded to you, please feel free to remind us. The closing of submission of written queries is the 26th of January. The RFP deadline is the 2nd of Feb, and we're hoping to communicate the awards by the 23rd of Feb. If there is financial due diligence to be undertaken, that will be done in the week of the 9th of March. And after that, we are hoping to sign the awards and the contracts by the 18th of March, following which we will make a public announcement of the awards, the partners selected. By the 30th of April, we are intending to review the advocacy plans that our partners will be developing. And there will also be a midterm project review undertaken, which will vary by project depending on the timeline that the partner has chosen for the project. And finally, we will have the final reports and performance data, which will again depend on the timelines of the project selected by the partner. And typically the project length will be between 6 to 18 months. Next slide, please. So before we go into the panel Q&A, we just wanted to share some of the written queries that we have received. One of the most popular questions was, is there more than one proposal allowed per country? And at this stage, there's no restriction on the number of applications per country, although we'd like to note that we would, of course, want to have a fair geographical representation across the target regions mentioned in the proposal form. So at this stage, there's no restriction. Please go ahead and apply. Will the award be issued in French, Spanish, or Portuguese? The proposals can be submitted in English, French, Spanish, and Portuguese, but the actual award contract or the legal terms will be in English. And the terms and conditions of this is already mentioned in the RFP document towards the bottom. Do the advocacy strategies and dissemination materials need to be in English? So the advocacy strategies and the materials that you will develop can be in any local language. So it can be in English, French, Spanish, Portuguese, or another language based on the region. Although if possible, we would appreciate if the plans developed by the partners, which will be reviewed by FIND and UNITAID, as well as the selection committee, they should ideally, if possible, be in one of the 4 languages mentioned here. What is the definition of a low and middle income country? I have already put a link to the definition that we are referring to in the chat. Next slide, please. Is there a required template for the proposal? No, there's no template for the narrative section of the proposal. So you will see in section 7 of the RFP document, there are detailed application guidelines. And we basically require all the information to be shared in a PDF, which should be no more than 9 pages in length. Can organizations apply as a consortium? Yes, partnerships and consortia are accepted, but we require applications to be submitted by a single lead organization with whom we will deal and we will contract. So as far as we are concerned, we will only be dealing with one organization. And in the event that you are forming a consortium, your partners need to also be locally registered in the same country from where you are applying. And as mentioned here, the maximum award will still remain $100,000 US. Next slide, please. So just to reiterate, all this information is available on our website, on our Calls for Partners page. By tomorrow, you will also have the recording to this session available on the same page. And if there are any changes to the timelines or any updates to be made, they will also be made on the same page. So please keep referring back to our Calls for Partners page. Thank you.
Thank you, Karishma. And I think, Nosheen, we want to get into the Q&A now. There have been quite a number of people already putting in questions in the Q&A box. Please put them there, as we will be able to answer some of them. We will attempt to first, through me, answer some of them live, so that through the interpretation, you can listen to the answers, and where needed, get follow-up questions. We will then also attempt, while we go through, to type the answers, and then you will see them in the answered box. So please don't use the chat box for this, but the Q&A. So I'd like to start now to add a clarification to some of the practical things that Nosheen and Karishma has happened, and I'll start from the top. For INGOs, can more than one country office apply for the call? As the guidelines, it's mentioned that applicants are limited to one proposal per organization. So first of all, as was indicated, we would expect to be able to fund more than one proposal per country, but not from the same office. One organization for one country can propose one proposal. But for international NGOs that have multiple programs, as long as your office is registered legally in a country and can directly contract with us for work in that country, you can apply. So World Vision Cambodia, if that's a separate office with legal registration from World Vision in Tanzania, could both have an application. The international NGO itself, their headquarters cannot apply. So if we would have to fund you through a head office of whatever sort, you cannot apply. So we really need national level registrations in place. This does mean that several proposals for countries can go in. There's another question down in the overview that says, can we do a proposal for multiple countries? No, every proposal has to be for one country. And I think Javier has mentioned that there's very small countries in Latin America. And I would say that's a good thing. That means that you can do more work to provide awareness raising and a push for work in that country. So please focus on the country and potentially have partners in multiple countries. There's a question from Mr. Zaman, whether NGOs or CBOs are allowed to submit RFPs with a partnership arrangement with other NGOs. The answer is yes, but we need one partner to submit the proposal. In that proposal, it can be indicated whether you are interested to work with other partners and that you have that experience, but we would only work with one partner that we would have responsible for the overall implementation. There's a number of questions on countries. South Asia, I just looked it up. There is a link in the chat with the OECD current registration. So every country in South Asia, for instance, at the moment, is considered low and middle income country. Also, Sri Lanka, Nepal, India, Pakistan, Bangladesh are all low middle income countries. Kenya is still a low and middle income country, so can apply. South Africa is actually not a low middle income country anymore, but it's classified as upper middle income, so would not be able to apply for this call. So I see some other questions about, can we sorry, am I going too fast for the interpretation?
Maybe slow down just a bit.
So good. So the total envelope that will be issued for this RFP is, at the moment, we have a amount available of $2 million US dollars. So that would allow 20 to 25 proposals at a minimum to be issued. So that's giving an impression. We don't have a formal fixed amount. There could be a little bit more money added to this if we get good proposals, but that's about the level we're in. So I see a few, and I might need some translation help at some point, but Paraguay, again, you should look up the list that we have posted in the list, but Paraguay is an LMIC, so should be able to apply. If an NGO has specific target groups, can they apply? The answer is yes. In principle, yes. Our overall goal is to increase testing rates and linking of patients to treatment facilities in the country for COVID. So if a specific target group is it would be helping to raise awareness of testing overall for COVID, as well as linking to COVID treatment, that would be allowed. Of course, we're looking at helping to increase testing rates overall. So if it's a very niche overview, you would potentially lose some points. But if you are reaching a very hard to reach group, this could be possible. So please carefully consider how the target group links to the overall goal of testing before you submit a proposal. Angela Caceres, indeed, it is possible to apply in a consortium as long as the lead agency applies. So you can organize that behind the scenes. We don't need to see that. You can mention it in the proposals, but we have to have one application from one partner that takes the lead. But you cannot do more than one country. You have to focus that on a single country. So one more issue, I think, on regional approaches, and I would ask maybe Karishma to add something. We, as a coordinating body, will bring together all the winning applicants to share materials, to do training, to inform people about the latest knowledge on testing and treating strategies. We will help with materials that are created globally and centrally that would be available to you to adapt in local languages and for local approaches. That part of work we will do, but we will not expect anyone to fund regional, meaning cross-border collaborations. We want our partners to focus on in-country awareness raising and scale up of targets. So
yes, just to add to that, as Willow was mentioning, we will be, once the partners are selected, we hope to organize meetings maybe every 1 month or every 2 months, where we can get all the partners together and form sort of like a community of practice, where these partners can actually share learnings, what they're doing in their country, how they're implementing their advocacy strategies. But we will, as Willow said, not be entertaining regional by regional. We mean within a country, and we don't mean regional as in the region of South Asia. So countries can definitely exchange their ideas, but one organization in an LMIC can apply to this RFP and not as a consortium across countries.
So there's a question whether NGOs that proposes to an RFP can include new staff and add in addition to existing human resources to manage the project. The answer is yes. We really are looking for you to explain us how you can help get to our goals of better awareness, better information provision on testing and treating strategies. How you apply that funds, whether that's for staff, for consultants, for working with a PR agency, for working with other NGOs, that's up to you to decide how you think you can be most successful. We don't have any restrictions on how the money is to be used. Obviously, the envelope is limited, the total amount of money you can ask for, but there is no prescription, and there's no there will be no scoring done on how the money is used to be spent. So you have to provide that. Test growth, how does test growth manage? That's an interesting question. So there are each country is centrally reporting the amount of tests that it applies, and also within there's adjustments made for the impact on the the current state of the pandemic in that country. So there's adjustments to ensure that if there's very little COVID at some point in a country, there's still sufficient testing based on the number of tests provided. Largely at this call, I think the question is to be answered: how can we make sure that testing is understood by people, that misinformation is taken out of the way, that people understand how to get access to testing, and therefore I would say that that's sort of the focus of what we want to do. There's a lot of questions, so I'm trying to keep up. If a country has reached a testing goal, are groups from that country still eligible to apply? Yes, there is no restriction there. We know that the goal, in all honesty, the goals that are set globally are still lacking ambition, and therefore we would be more than happy for a country that's already showcasing a good testing rate to go even further to global equity. So I see no issues there. If an organization wants to be a multiple consortium, that is possible, but you can only be the lead partner in one. And as I mentioned before, if you're in a consortium of somebody else but not a lead, we don't have any contract with you. We only work through the partner. So it's up to you to decide how you want to participate, but you can only be the lead of one proposal for one country. Sorry, let me go back. So maybe Nosheen or Karishma, if you can see, if you see any other questions, I need to translate the quick number of questions to make sure I answer them right.
Certainly. Thanks, Willow. I'll take a look through the box and see what we can address. Sorry, go ahead.
No, go ahead.
Someone's asking if there are key criteria for our views of a successful proposal. I do want to stress again that we've kept the requirements for these proposals quite broad. So we're really looking to review a broad range of proposals across target audiences, across countries, and with a wide range of proposed strategies and activities and media engagement, et cetera, to reach these audiences. So for us, as long as you meet the minimal criteria of increasing testing access and linkage to treatment, your proposal will be well received and considered. And going off of that, there's another question about specific objectives to focus on while writing the proposal. Again, you know, we've tried to remain quite open-minded and broad in our RFP requirements. So as long as, again, you adhere to the objectives of increasing testing and linkage to treatment within your proposed activities, we will happily consider it. And in terms of the countries that are eligible for the proposed activities, it's limited to low and middle income countries, so we wouldn't be considering upper middle income countries or high income countries.
Thank you, Nosheen. There's two questions in Spanish that I now translated, and they're both about working on specific target groups that are, for instance, a civil society organization working on respiratory diseases, for instance, on tuberculosis, and specific sub-communities like indigenous communities or people living with HIV. Those are all certainly very much eligible, and we would love to build up a relationship. We think that testing could have cross benefits with other diseases like HIV, with TB, with other infectious diseases. The focus, of course, at the moment is testing for COVID, but we certainly would welcome organizations that have already strong networks. For instance, that communities living with TB, living with HIV, and are willing to sort of put in their networks and their efforts in ensuring that more information gets available on COVID testing, and information to their target groups. So both the examples in terms of either LGBTQ communities that have organizations have a good network in those communities and are willing to use that to inform them about testing and COVID are eligible. And the same goes for TB and respiratory diseases. We think that are exactly the organizations that can help reach large number of organizations through their existing networks. There's one question on providing proposal writing support. No, you will have to write a good quality proposal yourself. I'm afraid we currently don't have that opportunity. In case you feel that is something that is not very strong, we suggest you work together with another partner that can be the lead and that can work with you as an organization, and that you can negotiate these roles beforehand.
We also have a question from Javier Belloc, who is asking who is leading this RFP review and allocation, FIND or civil society reps in the pillars. So we have a selection committee that's being put together for each language review. And the selection committee does include civil society representation on the Act A diagnostics as well as therapeutics pillars. And so we have experts in advocacy from around the globe who will be forming this selection committee.
Can I ask you, Noushin, or whoever is helping us organize, to get Chase to unmute and be able to speak, because I think he, as a civil society representative, wants to add a few words, and I think that's useful.
Yes, absolutely. Carolina, can we unmute Chase?
I think that's.
Oh, perfect.
Yeah, great. Thanks.
Great, thank you.
Thanks.
Please.
I just wanted to highlight a couple points. You know, and as you've highlighted, this isn't. They're not clear elements that have been identified yet as particular points of emphasis that will be seen more positively or more negatively. I just wanted to highlight a couple of the ideas that the civil society delegation to the diagnostics pillar have been really emphasizing in our input to various processes, and those ideas include the question of equity in terms of the number of tests that are being given on average per country. That's a target, but as a sub-objective, we've been encouraging Act A agencies to think about questions of equity, and that could include both who has access, whether the access is being privatized, whether certain populations are facing bigger barriers to access. So some of those questions around equity are things we've tried to highlight as important, and also questions of impact. You know, are the tests that are being carried out, is it just a matter of reaching a volume of number of tests, or are the strategies being taken forward? Are they maximizing the impact of the tests that are being accessed? And I just wanted to highlight that because that's something we've been communicating as something we're hoping the agencies are taking into account. And of course, that's not to say that that's not necessarily something established as an important box to check in submission. So it's not like that's something the representatives will take. I think, correct me if I'm wrong, that whole process of evaluating is those parameters are going to be further decided, and there's nothing decided right now. But I just wanted to add that, just to say that from the delegation side, we're trying to push those principles across the various opportunities that we have to raise our voice. And it would be interesting, I think, for civil society organizations to have that in mind, and maybe something they could consider. And I just, again, wanted to thank Find and Unidate for taking this forward. It's fantastic that this opportunity is available, and wishing everybody the best of luck in their proposals. And feel happy to qualify any of the stuff, or just reinforce the qualifications I put on what I shared, because it was really just sharing broader context, and it doesn't directly inform any evaluation of or parameters or priorities in the evaluation of this particular proposal.
Thank you very much, Chase. I'm not going to qualify anything. To be clear, I think we really want to hear more from civil society, and definitely understand that country voices can help us be a lot stronger also in our global coordination role. So absolutely agree with you, and thank you very much for that work. I'm going to ask one of our other co-leads, coordinators, Alexandra Costa from UNICEF, to add a few words. First, I see another question or two that I maybe can answer, and then in the meanwhile, we can unmute Alexander. Can we propose a funding for an extension of an existing project? That is certainly possible. Of course, it will be hard for us to immediately understand what your objectives were and how they've been achieved, but that experience that can be brought to bear would definitely be possible. We would still request the proposal to be written as an independent activity that builds on prior experience. But as long as you make clear how that's relevant, we do not mind if there's any prior investments. Of course, we even would love to see our work being leveraged by prior experience and knowledge on this topic. So I think that's an answer.
Willow, can I step in?
Yes, you can. Thank you very much, Alexander. Please add your...
Thanks, Willow. I just want to add something to this, which is very much in line with what you said. I think it's an asset to have access to target populations that are relevant. It's an asset to already have been implementing a project that complements this one. But as Willow said, we have no way of validating this. And I think making the linkage, it's fine, as long as your proposal is not dependent on the other one, as long as it is submitted and meets the standards and the objectives of this RFP. And I'm sure that some organizations will have access to certain populations who will be implementing complementary projects. You're more than welcome to add that information as part of the proposal, but not make it dependent on the other project. There was another important question here on the availability of tests. I think it has already been answered, but I thought there was a very interesting one. We're basically trying to target demand generation, right? That access and uptake of tests. And if these projects succeed, there will be an increase in demand. Generally speaking, we know there's low demand for tests and there is a bigger supply, but it all depends on how big is this increase. So for example, I think the question, if I'm not wrong, came from Nigeria. There could be a significant increase in demand there. If we're talking about a small country with a small population, we'll probably be able to, especially if it's a low income country, we'll probably be able to supply through UNICEF procurement and the ACT-A partnership. But I can't reassure you that, for example, if you have a significant surge in demand coming from Nigeria, that we're going to be able to meet it. We're going to do everything we can in order to meet the demand, everything in our power to do so.
Thanks, Alexander. I would add to that point, please try us. I mean, if through this partnership, we can increase demand, we can increase awareness, and the demand for testing goes up that much that we're getting a supply problem, I think we are doing very well. We are knowing that additional funding is being requested to work for the coming year for a growing supply to UNICEF, to a global fund. So I would love to see us be so successful as advocates that we can say that we have actually that the demand, we've managed to get demand outstrip supply. There's also a question.
Can I make another comment?
Yes, one more, please. Thank you.
Yeah, so there were a few questions about target populations. Obviously, we cannot target everybody, and we have to be selective and strategic. But in the process of assessing where the bottlenecks are, we've identified that the lack of prioritization for diagnostics by decision makers in each country has contributed to the fact that there's low uptake in diagnostics. So I think, if I remember well, in the RFP, we're basically looking for different target audiences, including the community engagement to generate demand for tests by increasing awareness and understanding about the importance of being diagnosed or being tested. But there's also this big bottleneck at the leadership level to understand the importance of diagnostics and prioritize it as part of the national response. So I'm just giving you suggestions on where we see the main bottlenecks, both at the leadership level and at the community level. But that does not exclude other target audiences from being included in the proposal. Over.
So we have a question from Musa.
Yeah. Sorry. Yes. Do you want to take that one, please?
Yes.
Go ahead, Musa.
So Musa Salisu asks, can you take us through the budget template and highlight some tips on allowable costs and general information around the budget? So basically, as our template already shows, you can hire staff. So you can put the cost of your personnel that will be required to implement the project. You can also have consultants on board or contractual services. For example, you may want to hire a social media agency or a media agency, or you may have a large political event, or you might organize a marathon. It really depends. Based on that, you can have reimbursable expenses. So room rentals, travel, media purchases, printing expenses, development of videos and other communication and awareness generating materials can be included in that. And there is also an overhead indirect recovery cost, which is a percentage to a maximum of 12%. And just to highlight that all figures in the budget should be submitted in US dollars. And if you need to use a conversion rate, please refer to Oanda. That is the conversion that we accept. So that's Oanda. Anything that you would like to add, Willow?
Yeah, thank you. I think what is important here is that our main goal is to understand what you can achieve and how much you can get done for the funding. Our budget, as we said, the different types of activities. The different type of activities, whether it's personnel or consultants or working with partners, is less important to us. There's a strict upper limit to the amount of money requested, but we will be looking more at what you're proposing to achieve and what you can do with the funding and how you spend the funding. Of course, we need to understand that this is realistic, so you don't promise anything that is impossible, but our focus will be mostly around the deliverables, not about the budget. So that's probably important. I would like to ask whether it's, so Mariana Fernandez is asking whether surveillance of anti-competitive actions is allowed as an activity. The answer would be possibly yes, of course, if that's a major hurdle for growing in demand in a certain country, and if you can explain how that works in that specific local context. I don't know the specific country, and this is not the platform to discuss it, but I don't see why it would be advanced, because I could see how anti-competitive actions could lead to a lower demand for diagnostic testing. So that would be my answer there. there's a point from Sharon Ann about the numbers and the needed and the volumes. So there is a very clear description of needed volumes, request and the funding that's available. However, of course, this whether this can be achieved depends on whether in the coming months the global community is putting up the funding that's being requested. There is a lot of clarity on that part. I think at the moment we're focusing on a more decentralized level of country demand and the request, and those won't all be met through global supply, but also through national supply. I think the question we have seen and the bottleneck we try to approach here is how can we increase demand that we know is significantly below required levels for public health action in countries. I didn't want to dismiss the need for that specifically, but I do believe we need, we're breaking this down into a specific question for this call for proposals. Let me see, I think we're getting to a point where we've answered many of the questions. If any of my fellow partners on the working groups, on the organizing committee have anything to ask, or if anyone else has a final question, please drop it in the Q&A, even if it's a follow-up question. It does look like we are getting to a point where most things are met. So, Noshin, do you want to take it over to help us close, or Karishma?
Before we wrap things up, Willow, perhaps we can reiterate the ask to the audience and see if there's any questions that we could answer live. Please feel free to utilize the hand raising function if you'd like to ask a question directly to the panel. I'm not seeing any hands up, so it might mean that we've been pretty on top of the Q&A box and we've addressed all the queries so far. So then I would reiterate to the group that this is certainly not the only opportunity to ask questions or to gain any clarifications on the RFP guidelines and requirements. So please feel free to email us at advocacy_RFP@finddiagnostics.org. And as always, please keep an eye on the find.org calls for partners page where the RFP is hosted, because we will be uploading the recording of today's webinar, as well as the presentation material and a frequently asked questions document to ensure that we're gathering all of the most common queries and sharing the responses. So in the last few minutes that we do have a quick poll for all participants that's just popped up on the screen. So we'd appreciate if you could take a moment and indicate your interest in applying, as well as the language in which you submit your application. Thank you.
And last but not the least, please also help us to spread the word about this RFP. I'm going to drop a link to our social media toolkit, which is available in 4 languages. So please share it with your partners in your country. Thank you very much.
And while people are answering these 2 basic questions, I want to finish, first of all, for everyone who's attended and listening in. I want to thank our interpreters that have done a massive job in keeping up with the speed and accents that we have been throwing through this RFP. But most importantly, I would like to express that we really hope with this work that we can create a network of advocacy, community organizations, people that have public health action at their heart, that are willing to go out and make and help create awareness for testing and test and treat strategies. And that we'll be looking forward on creating a partnership with a lot of you in the coming years, and that this is even going to last beyond COVID. But let's use this opportunity to come together and get very strong proposals for the stated objectives. This is really important that we know, not just, this is certainly not to us, this is for patients worldwide, this is for people in the countries that you care about, and we look forward to your great proposals in this area.
We have one hand raised. Should we take one final question, Willow?
I'm always good for another question.
Mabel, I think you're unmuted now. You can take the floor.
Thank you so much for the presentation. My name is Mabel. I'm calling from Uganda, and we are interested in applying. Just to ask the level of involvement of UNICEF and CHAI country offices. What is the level of their involvement in the implementation of the project? Thank you.
Thank you. The question is that UNICEF and CHAI global coordination points are involved on the top level, and therefore UNICEF and CHAI offices are not able to apply to this call for proposals, similar to find offices or, for example. Maybe Alexander, if you want to, if you're still on the line, if you want to add something more specific about how we foresee working when we have allocated and have been able to find the winning applicants.
So the first point is I fully agree with you, because we are involved in the global coordination. Our offices, CHAI and UNICEF, will not be able to apply. The second thing is that I think there's an element of a community of practice that will emerge from this. And we, as UNICEF at the global level, we're also contracting an organization that will work on the global advocacy. And we do hope there will be a lot of cross-fertilization. We're learning from the partners that have been selected through this RFP, collecting materials they're developing, and also doing the same thing, sharing the information that we are collecting at a global level through some of the social listening mechanisms that we have and some of the advocacy priorities we have identified to help inform your interventions at the country level. This is not prescriptive. This is really what we're trying to create is a community, just like Willow mentioned, and share as much information as we can in order to achieve a common goal. Over to you.
Thank you very much, Alexander. With this, I thank everyone for attending, and we look forward to see many good proposals.
Thank you, Willow and Find, for the great collaboration. Have a good day.
Thank you, everybody. Bye-bye.